Hi, my name is Inji Ho, and I'm going to go through the case study of Margaret. The symptoms she had was that she began to feel anxious, nervous, and panicky when she goes to shopping. Some of the symptoms are heart palpitation, feeling of smothering, nausea, labored breathing, and chest pain. This experience became a stimulation for her that eventually leads her to make a conscious effort to even go out. This can be explained by a two-factor model where conditioned responses leads to threat. She sometimes bursts into tears for no reason and feels dread. She thinks that all of those behaviors and thoughts were embarrassing to other people in the shop. She said, I think I was already anxious even before I went out. Anyway, I was in the shop and I began to feel a bit breathless and nauseous. I held tight onto the trolley and I remember thinking that I was so embarrassing. Everybody looking at me and me thinking I was so stupid. That's me, stupid. When the symptoms were about to be activated, she also remembers thinking about that she was so embarrassing. The embarrassment that she recalls triggers the panic attack. This is the common symptoms for panic attack. The clearest disorder of her symptom would be a panic disorder. Panic disorder is a sudden, intense episode of apprehension, terror, feelings of impending doom. It's more of worrying about having panic attack rather than the situation. Margaret has shown some of the physical symptoms of panic disorder, which are heart palpitation, feeling of smothering, chest pain, and etc. She had acute attacks since her panic attacks seemed to occur in a specific situation, a shop. But she has shown some of the other symptoms of anxiety disorder other than panic attack. Unsurprisingly, 80% of the anxiety disorder displays comorbidity, which is the overlapping of the symptoms. Margaret also has few symptoms of social anxiety disorder. She fears that she will act in a way or show such symptoms of being panicky and escaping from the shop that these will be negatively evaluated by the crowds. She fears that crowds and the evaluation of the crowds. For people in social anxiety disorder, social situations almost always provoke fear and anxiety. For Margaret's case, she begins to fear and get nervous even before she gets in the shop. Triggered situations are avoided or else endured with intense anxiety for social anxiety disorder. Since this event is such an intense stress for her, she just avoids by staying in. For the etiology of her symptoms would be, first of all, the etiology of her panic attack is through interoceptive conditioning, which is a classical conditioning of panic in response to the internal bodily sensation. Margaret probably have a high anxiety sensitivity index. Her disorder can also be interpreted through fear of fear hypothesis. This is the expectations about the catastrophic consequences of having a public panic attack. Furthermore, Margaret as a female are twice more likely to have an anxiety disorder than men do. So, what interventions could be used with Margaret? Cognitive therapy examines how negative thoughts or cognitions contribute to anxiety. And behavior therapy examines how a person behave and react in situations that trigger anxiety. We know that she has catastrophic interpretation about her bodily sensation and maladaptive thoughts about the crowds and herself. Therapists, by using cognitive therapy, can try to help Margaret fix her negative thoughts. Guide her to keep a thought record for a week, noting when her thoughts were negative so that she gains knowledge of her behaviors and innate thoughts. Also, with behavior therapy, therapists can give Margaret a self-help guide that teaches her what and how to manage her thoughts and behaviors. That would be having positive thoughts and having a self-talk whenever she feels anxiety. She can also use a systematic desensitization, which is a gradual exposure to the anxiety-provoking situation or objects. By doing this, Margaret will be able to manage herself better. So the prognosis for her would be she will probably start using self-help guided treatment by herself every time she goes to shopping and when the symptoms were about to be activated through her thoughts. Actually, Margaret herself had a courage to manage the anxiety and panic. She got back in and finished shopping right after she had a panic attack. As she got the information about self-help on a panic attack, she used it right back to manage her negative thoughts. She had a self-talk in a positive way to manage herself. She had a hope to be cured on her disorders. As she keeps on facing the anxiety in the shop by going to the shop occasionally and managing her thoughts in the process of shopping, she will do great.